Hello and welcome to Love, Sass, and Grass. I am your host, Laura Hamilton. This podcast is meant for adults only. It is a support community for those going through menopause and libido issues, as well as cannabis information and education. Any of the topics or products covered in this podcast should not be considered medical advice. Before stopping or starting any medication, please contact your medical professional first. As we love talking about cannabis, please respect the laws of your local jurisdiction regarding its use, consumption, and sale. Today, I'm very excited to do the interview with Kim Lam of Apollo Cannabis. Kim is the lead patient care specialist and international medical graduate, kids. International. She grew up in Mississauga, completed her clinical rotations in Chicago, Toronto, and Montreal. She focuses on pain management and
physiatry.
That's a new word for me. Physiatry. Led her to better understand medical cannabis and the endocannabinoid system. Kim has helped hundreds of patients with all types of conditions to utilize medical cannabis for symptom management. She has also been involved with research at Apollo clinics, and her current focus is assisting our veterans of the Canadian Armed Forces with their medical cannabis treatment. Oh my God, welcome. Welcome to Love, Sass, and Grass.
Thank you for having me. Super cool.
I'm so excited. I'm very excited. Now, why don't you walk us through what it is like to be a medical cannabis patient? Somebody picks up the phone and goes, "Can cannabis help me?" Walk us through that process.
So essentially, let's just say you've made your appointment. We're going to fly past that, and you have your appointment with one of our healthcare practitioners. So it's either going to be a doctor, depending on the province you're in, or a nurse practitioner. Either way, they're very experienced in prescribing medical cannabis. They've been doing it for a little while. And so when you get the call, essentially you're jumping right into a conversation as to, is cannabis for you? And if it is, how it could help you, what are their recommendations, and off you go. So, I mean, I'm generalizing it a little bit. The good thing is that because we do take our clinic anyway, we take your medical history ahead of time. We allow you to kind of put out, what it is you're going through, what are your main symptoms. And so when a doctor or the nurse practitioner goes into the phone call, they've already taken a look at your file. So you sort of bypass all of that talk, and essentially you're just focusing on how is cannabis going to help. That's the main focus of the call. In one of our initial emails, we always include an educational video. So if you're super new to cannabis, it gives you at least a baseline as to how cannabis is supposed to work, how medical is supposed to work, not just cannabis in general. So what to expect. So at least you're not going in completely blind per se. And then, it's open for questions. After you speak with the healthcare practitioner, we do recognize that a doctor's visit can be quite short. That's just how it is, right? That's just how our province, every single province works. So within 24 hours of your call, sometimes almost right away, you get a call from one of our educators. And the idea of the educator is not necessarily to educate you if you don't need it, but just to then process the prescription. A lot of people get nervous talking to a healthcare professional. So honestly, they leave their questions at the end and they forget. So this is a great time to then ask your questions, no matter how embarrassing, and have a conversation for however long you need. And then we get things set up and help you with your order if necessary and go from there. And then after that, you're more than welcome to call us anytime with more questions.
Oh, that's amazing. And it's so interesting that you brought up embarrassing questions because my focus for this podcast is menopause and libido.
Yes.
And you want to talk about hitting the embarrassment button? That's 2 embarrassment buttons right there.
Yeah.
And I would like to know, what are some good questions that you can bring up with a doctor that is not going to make you feel shame about talking about, for example, painful intercourse and the loss of libido due to menopause?
Right.
How can we bring up this subject to a doctor without dying of embarrassment and blindly forgetting until you leave the office?
Okay. So one big thing I want to make very clear, any doctor or nurse practitioner throughout their training has had images and information about our genitalia, our reproductive system, our sexual health. It's been in our faces for years, a lot of it, both from normal to not normal, or, we've seen it all. Like, that is not a joke. They have seen it all. So nothing phases them. Nothing is considered like an embarrassment to them. They don't have that. We don't have that gut reaction to be like, oh gosh, like here it comes. It just doesn't exist. Like, to us, it's like the human body. And I promise you that most healthcare practitioners absolutely do not care. Like, it's nothing to them. It is as simple as talking about your knee pain. So I think it's really important for anybody going into that conversation to recognize that, because it'll make it easier for you to bring up. My next point with that is just to say it. Like, literally, you just have to say it, because the minute the words come out of your mouth, you've now like gone over this hump of anxiety that you've been. And for them, it's easier, because I'm going to tell you right now, healthcare practitioners, we all know they're quick, they're to the point, they just want to get there, right? And they want to help you. So you just need to be upfront about it. Don't be ashamed, because you're the only one feeling that embarrassment. For them, it's every day. That being said, I'll be honest with you, like, patients, bless their hearts, have been very forthcoming and upfront about these conditions. So already for us, we're already hearing it. We know. So if you're coming in new, we've already talked about it. And it's completely normal. And who else are you going to talk about it with, right? Like, this is the moment. We've heard about it. We've seen it. It's not new to us. So the best way to bring it up is just to be upfront. When the doctor asks, like, what are you here for? What are the symptoms that are concerning to you? You just say, like, yep, it's intercourse is painful. Or for males, even, like, I have a hard time having an erection. For women, I have a hard time lubricating. Or for those who are going through menopause, they just don't have that desire. You can say that, like, just say it. You just have to say it. And I promise you, after you've said the words, like, it's so much better afterwards. Yeah, that's the best advice I really have. Honestly, I don't have any.
And I think that is perfect advice, because, for me to say, it's okay to talk to your doctor and say, I'm having problems with my libido. But actually hearing it from a doctor saying, please talk to me about your libido, because I want you to be healthy.
Yeah. It's a very important part of our lives. Like, everyone experiences it. It's honestly like human nature, right? So it is not abnormal. It is not unusual in any way. So you just have to say it, even if it sounds weird the first time you say it. It's for you. It's for the patient to just get over that anxiety.
I'm so pleased that you said that. Oh my God, really? Because this could really change a lot of lives.
Yeah.
Saying, I don't want to feel shame talking to my doctor about menopause or libido or pain. And I think that that's important. Now, what are some of the products and some of the forms of cannabis that a medical cannabis patient can bring into their lives?
So let's talk general, like very general. Essentially, you can either take cannabis orally, or you can vape it, or there's topicals as well. So either it's like coming in through your skin, you're eating it, or you're vaping it or smoking it. Obviously, as a medical clinic, we don't recommend smoking cannabis. We always go with vaping if you must. We are supportive of that. So, and they all do very different things, and it's all about your lifestyle. And so, in very rare situations, would a doctor or healthcare practitioner ever force you to use one way over the other? At the end of the day, it is your choice, truly. And so with vaping, it's quick, it's easy. The cons of it is that the effects don't last as long. And of course, there is the concern of damage to your lungs, not necessarily from the cannabis itself, actually. That's really not the problem, but rather just the smoke itself. So if you choose that route, we always recommend having a proper vaporizer. Plus, it's just like you just get all of the good flavors of cannabis through that method anyway.
It's true. It's true. The difference between like smoking a joint and smoking it through a vaporizer is very different.
It's huge. Exactly. Yeah. So there's a big difference there. Always worth a try. When you use it orally, it takes time for it to kick in, take effect. Some methods are faster than others. but the effects last a long time and it does build up in your system. And obviously, I'm sure you know, like for a lot of new users, that definitely seems like the easiest way to go. You can dose it, it's discreet, et cetera, et cetera. And then obviously, you know, not recently, but in recent years, topical has been a big topic, so to speak. And so with topicals, I have a mixed opinion about it. I'm always down, like, definitely try. Like, I'm not against trying anything when it comes to cannabis. It's just that the results as to how much gets actually absorbed through your skin, how much is, you know, you have receptors for cannabis in your skin too. So it's like, it's getting its benefits, but how much is actually getting through into your body. So that's up for debate. But I'll be honest with you, like a lot of patients are getting great results from it. So hey, like I'll take it, you know?
Yeah.
Yeah.
The cannabis lube that I tried for the first time was such a game changer to me.
Yeah.
And I think that kind of inspired me to start doing this podcast because I had tried something
Yes.
that had really affected me in a very positive way.
I love it. Amazing.
And I wanted to stand on my balcony with a bullhorn and
Just
tell everybody
the whole world,
go to this store and buy this lube right now.
Yeah. So, you know, it's funny you should say that because I said like generally these are the forms we recommend. However, it is said that you could theoretically, it's been shown that if you use it topically, like around the vaginal area, it can absorb that way because it's all like mucous membrane, which means it absorbs well. So it is a recommended method of use for like libido or even pain or for lubrication. So you're totally on the right track, definitely.
Oh, that makes me so happy because there was a part of me who was like, is this really happening or is this a placebo effect and I'm making it happen? So
either wouldn't be a bad thing.
Either way, yeah,
it really isn't. Honestly, like I'm not against that at all. Because like the lube itself, like, I mean, depending on where you're getting it from, it's not necessarily harmful cannabis in that way, right? So whether or not it's a placebo effect or not, point is it works for you.
Yeah. Oh, definitely. Yeah. Are you kidding me? Oh my goodness. I had some people on speed dials. Like, you better get over here. Because guess what? I just cracked it open.
It's time. The time is now.
The time is now.
Yeah. So
it really helped a friend of mine who was going through cancer. Not only going through cancer, but going through chemopause.
Oh, yeah.
So immediately hit a brick wall, chemopause, no libido, pain, dryness, upset. And I told her about cannabis lube. And her description was, I went to a hotel with my husband and we dirtied all of the towels. And I was like, all right, one marriage saved.
Amazing. So for medical cannabis, as of right now, like on the medical side of things, like the producers that do just prescriptions, there isn't like a lube. Like there isn't like, you know, specific products to like a lubrication, essentially. They don't have that. They used to be an oil. So there was a company that had from California that had brought over specifically like an oil for application to your vaginal area. But realistically, and not to minimize what they were doing, but it is just cannabis oil. Like it's not any different from what you would ingest orally. So a cannabis lube like you're talking about is very helpful, obviously, better application. But for those who may not have access or want to go through their prescription, realistically, it's all about just applying it just where it needs to go. And if that means using cannabis oil, maybe mixing it into a safe cream that you can use down there, you can do that. And it is effective because at the end of the day, it's just usually cannabis oils, especially from a medical producer, are MCT or olive or avocado oil. So it's fairly safe. But it's really good that you found like something specific to that.
Oh,
that's really helpful.
Did I ever? Oh, my goodness.
Yeah.
And it's interesting that you talked about olive oil because I started infusing just at home olive oil to, you know, for my own kind of general pain relief because I know olive oil and human skin are good friends. Yeah. So I was doing that. And then also, you know, I can either put it on my arthritic wrist or I can put it in my salad dressing.
That's a really good idea for sure.
The other question I have is I know that people want to know if you use a cannabis lube or some sort of enhancer oil on your vaginal area and you have penetrational sex with somebody who has a penis, does the person with the penis get a positive drug test?
Oh, that's a really good question. So I can't promise that, but they shouldn't. That physiologically wouldn't make any sense. When you apply anything topically, it doesn't have the chance to even get into your bloodstream once it's absorbed through the mucous membrane, because again, you have quite a few receptors on the way, if that makes any sense. From our experience, anybody who's used topical from our clinic experience, so again, there has been I'm sure there has been, but none that's come out that's, revolutionary. Any real research that has shown definitively that it won't show up. In order for it to show up on, let's say, a urine test, you have to use the cannabis itself. It has to go into your bloodstream, get metabolized by your kidneys, and then it's in your urine, and those metabolites actually stay there for a while, right? So it's not a good test to see if did that patient use cannabis last night and only last night. There's no, you can't test for that using what people are using, which is urine. So if you're using cannabis lube, your partner with a penis should not test positive for cannabis. I would like to think okay, well, maybe the concern is that it's literally around the urethra. What if it's I would assume you would clean yourself before you do one of those tests. So ideally, it really shouldn't show up. We have patients using CBD oil orally that contains negligible, but maybe 1 milligram, 2 milligrams of THC, and it doesn't show up positive on a urine test from our experience. So I would be hard pressed to it'd be unbelievable to me if it showed up positive.
Okay. Yeah. I do have people who have come up to me and said, I want to try the lube like you tried the lube.
Yeah.
But my husband's afraid because he, works in some sort of regularly tested career and is terrified of me using this and him doing it. So that would be a relief.
It is a great question. I'm just thinking in my head of how it just would not seem at all possible. Because like I had said in the beginning, there's a reason I'm on the fence about topicals even, right? Because for systemic symptoms like chronic fibromyalgia, for example, I'm not going to tell you use a topical because it's just not going to sink in enough. So that being said, what you could recommend is that you don't have to use, again, not to minimize your CBD lube. I mean, that's incredible, but you don't have to use it in that way. That is not the only way, right? So small, tiny amounts of THC for a woman consumed orally can help with your sexual desire, your sex drive, your libido, without you having actually to physically apply it to your vaginal area. You can
is
just
this
take
something like a microdosing? Or
yeah. So again, surprisingly enough, studies were evolving around women's health, right? Or those identifying as women, they're not out there. There's not a lot. So again, limited information. But what information we do have, too much THC, and THC specifically, can potentially actually suppress libido, right? So, I mean, there's that age-old, not rumor, but idea that men who smoke too much cannabis may not be able to have an erection. And it's not not true. Too much of it can suppress that response. But small amounts can actually increase it. So we call it a biphasic response. So there's just this window where if you go over it, you're doing too much and you're doing the opposite. So 2 to 5 milligrams of THC or consumed orally should actually help to increase libido quite a bit. So you don't have to actually apply it for those who are scared. And so it would only be her that tests positive.
Yay! Only one of us will be guilty, honey.
Only one. Yeah. The rest will be okay. And I say that from experience for sure. I cannot, surprisingly enough, I can't use THC to save my life. I respond very poorly to it. Very poorly. Huge supporter, can't do it. But
really?
Yeah. But I can use a mixed primarily high CBD oil with a touch of THC. That amount I was talking about, 2 to 5 milligrams, and I find that does more than enough. So it's an it's an option.
Oh, that is so great to hear.
Yeah.
Okay. Now, when you're talking about like concerns, I know that I have also had people who are concerned because they have maybe mental illness in their family and they're like, if I take cannabis, am I going to become like schizophrenic?
I love these questions. Yeah. That's a good question. Okay. Cannabis alone, let's say your average person, cannabis had no history of anything, potentially even a history. You don't take cannabis and suddenly it happens. Like that's just not the path of which it takes. So, as a clinic, we do actually ask about family history of substance abuse and psychiatric history. We do ask. So it's all about how much risk is there. And that's really the question. It's not that like it's going to happen to you, but how much risk is there in if I use cannabis is going to trigger this? So some factors include being those born or assigned male at birth. That is one big risk factor. Being young, using high THC from a young age, and having, of course, a history of some sort of psychiatric or mental health conditions, such as even depression, right? So those are some factors to consider that puts you at a little bit of a higher risk that if you keep using too much cannabis, you may trigger psychosis or at the very least, like increase your anxiety or make your mental health condition worse. But, our clinic sees patients with schizophrenia, like them themselves already diagnosed with it. Some we do avoid. We say, like, listen, we cannot allow access to THC through the prescription. Like, we're telling you, like, you need to use more CBD. That's what's going to help. And some are using THC and it helps them. So we've seen thousands of patients over the years, and not, from what I understand, we haven't had anyone call and say, like, I suddenly have schizophrenia, because we kind of assess for those things ahead of time. We assess for those risk factors. So
that's a relief to know.
Yeah.
Honestly.
So I want to say that cannabis does not cause schizophrenia, right? It's a complicated medical condition, that and bipolar, any kind of psychosis-based mental health condition. It's all about risk factors. So that's just something to keep in mind.
Okay, very good. That makes me so happy, because that is one of the questions and concerns that I've had people approach to me saying, "Oh, ask about whether or not I'm going to become like mentally ill from trying it." And I'm like, I don't think it works like that.
No,
no. I wanted to make sure to ask that question.
I will say, we had one incident where someone did suddenly develop psychosis. It happened once from the many years, and they were completely fine once they stopped. Like, they just stopped. Now, we then find out that there were history of things that we weren't made aware. They're actually completely functioning. They themselves didn't have this history, but they did have a history with like anxiety, some family history of psychosis that was unclear, but they were fine once they stopped it and things were okay. And honestly, we don't even know if it was the cannabis. So it's like, you don't know, but we said, like, let's just not do this. And it happened once. So that's like out of thousands of patients. So
that's
nothing. That's not.
There's
that
always going to be one.
Yeah, it's always going to be one person. Let's just say it's not at the top of the list of things you really need to be worried about.
Okay, so what is at the top of the list to be worried about?
So probably the number one complaint from medical patients is a dry mouth.
Really?
Probably the first one. Yeah. So first one is dry mouth. Technically, first one is like drowsiness, but most of the time they are using it to help them sleep, like if they're using THC. Very, very, very few patients, depending on age, do find that CBD makes them a bit sleepy. So, that happens. That's too bad. Dry mouth, again, with our more elderly population, we do get dizzy. It's easy for them to become dizzy on even CBD. Those are pretty much. Oh, and another one is upset stomach if they use it orally. So that usually either they literally just get over it. Like they're fine. They keep using it and they're okay. They have it with food that helps, or we switch the oil to something that's based in something else, because most cannabis oils are based in MCT, which is actually a very healthy oil. So they switch to something else like avocado, or make their own olive oil.
Right. Yeah. Wow, that's really interesting too. Yeah. Okay, that's good to know. And the other question that I always get is, is it okay for me to have cannabis in the house when I have children?
Yeah, like it's definitely okay to have in the house if you have children, especially if you have a prescription. But obviously, like every parent is responsible. Unfortunately, it is your responsibility to treat it like alcohol in the house, right? When you have kids. So you want to keep it locked away. You want to keep it out of their hands. All containers and all packages per Health Canada regulations are childproof. So even if they get their hands on it, assuming how young they are, they shouldn't be able to get into it. However, yeah, it is treat it like you would any kind of substance or alcohol to keep it away. You also want to keep it away from direct sunlight. Don't need to keep it in the fridge. Just room temperature away from direct sunlight will do. Our patients with children usually just lock it away. Yeah.
What about cats and dogs?
You should. So you definitely should, even if you have cats and dogs. So there's two sides of the debate. So there are people who've just given cannabis to their pets before, and apparently it works well. You have to be careful with that because there are pets who do respond quite negatively to cannabis. So you have to be super careful, and we can't advise you on that. It's best to talk to a veterinarian. So my advice is to keep it away if you weren't planning on giving it to your pet, to just keep it, high off the ground, keep it away, locked as you would with alcohol. I hate to compare it to that, but you got to treat it kind of the same way. However, I do know people who there's studies to show like they use like they give CBD to their pets and it helps with their aches and pains. I don't know the research behind it because I genuinely just have never looked it up. That's not something we think of, but definitely something to talk to a veterinarian about because it's iffy. It goes one way or the other depending on what it is.
Oh, amazing. The other thing I wanted to talk about just briefly is sleep. Because a lot of people who are going through menopause have sleep issues.
Yes. Hot flashes and sleep are the two. Actually, libido comes third usually with complaints, but sleep and hot flashes are a big thing, and sometimes they're tied. So THC and a little bit of CBD always helps tremendously with sleep. That's like the one thing that I can almost guarantee cannabis is going to help you with. One thing I'm confident about is using cannabis for sleep. And the best part is like if you find the right dose, most of the times you don't get that daytime grogginess, which is helpful. And it's just, there's no like harmful side effects. Cannabis itself on its own isn't physiologically addicting. So great option for that. So that's easy. Now, hot flashes, night sweats usually are tied into that difficulty with sleep. So again, that minimal amount of THC helps a lot. 2 to 5 milligrams apparently should be enough to help with the night sweats that kind of accompany that. And the other thing too with menopause, if you're trying to handle like any kind of symptoms throughout the daytime, it's recommended, that you microdose versus taking like one giant dose in the morning or smoking up a lot of THC. You kind of want to have that mix, keep it minimal, microdose throughout the day. So
microdosing has been all of a sudden, it's just like everywhere now. Microdosing.
For everything almost, just like microdose. Yeah, just kind of maintain that level. But yes, patients going through menopause that we have for sure, like it helps a lot with their sleep. Yeah.
Those are the main complaints that I hear. And like for me, I mean, I never experienced the hot flash, but I have a friend who I know somehow miraculously
don't think about it.
She literally has to change the sheets.
My goodness.
Because she has like just it's like she jumped in
bad.
And it's interesting. My mother had hot flashes where it could have been a blizzard outside and she was standing outside sweating. And I'm like, wow. And I've been expecting them, but it's been 2 years. And I figured if I haven't had a hot flash now, am I really going to have a hot flash?
No. Yeah. It kind of pops up or it doesn't. Yeah.
So
that's really good.
Well,
I don't know if you're over the hump yet, but like, I was just saying, like, don't even think about it.
I won't now.
Just put it out of your head. Yeah. Like mentality is key.
Oh, that's amazing. Yeah. Okay. So if people want to book an appointment at the Apollo Clinic, what is the process that they need to do? How do we get in touch with you?
So there's several ways. Like you can, for those who, don't want to talk to a person, which is all of us sometimes, you can do it online. And we have a lot of great blog posts on our website as well. So if you want to just get familiar with us first, check out the website. You can submit on an online submission unfortunately, we do have to call and confirm who you are. And we can call you and book you in for an appointment. You can call us directly. I'm pretty sure if you press 1, that's the booking line. Or you can send us an email and say, I want an appointment. And somebody will call you. So several different ways to make an appointment with us, and we'll figure out kind of where to put you and who to book you with and all that fun stuff.
That is amazing. Thank you so much for I know how busy you are.
No, it's okay.
And I hope I can talk to you again, because I really
Yes.
want to talk to you about your work with the vets and
Sure, yeah.
because I think that's a whole other episode.
It
Because
really is, yeah.
as soon as I
Bless
read
their
that, I'm
hearts.
like, oh, I gotta
Yeah.
talk to her about that too.
Yeah.
So I hope to have you on here again,
Yes,
because that would
please.
it's been
You have my
such
contact.
amazing time.
I would love to talk to you again.
Okay. Well, thank you so much, Kim. Thank
You're
you. And we'll
welcome.
talk to you again soon.
Okay, amazing. Hopefully I provided some information.
It was awesome. Are you kidding? The fact that you just reinforced the ability for somebody to feel confident walking in, going, hey, it hurts
Just say it.
it hurts when I have sex. Okay.
Yeah, just say
help
it.
me.
That's the
And
best
just
way.
giving someone the confidence that they can go to your clinic and know that they're not going to be shamed or judged or like any of that. That is, to me, the best news of all.
Yeah,
Okay?
honestly, you definitely won't be judged. I think if anything, like our educators might get nervous. If anything, they like you're on the confident side and they might be like, hey, I really don't want to F this up. Like I want to make this person feel. I've had that before when we used to train educators and they'd be like, hey, like, Kim, I have this person asking and I want to make sure I'm giving them the right information. Like it's never about, and it's not that we train them in this way, like genuinely, like we just want to help. And if it's something like that and we don't know, like we're just concerned that we're not going to be as helpful, and has nothing to do with judging. Because
yay. Down with shame.
Yeah.
I want everyone to have like a better intimate life, right?
Yeah, it's really important.
Okay. Well, we'll talk to you again soon. Thanks so much.
Yeah,
Bye.
of course. Thanks for having me.
Thank you for listening to Love, Sass, and Grass. Should you wish to contact me or to make a comment on any of the topics covered, I can be found on Instagram, Love, Sass, and Grass, or laurahamilton.cancan. For one-on-one, group, or semi-private consultation and educational classes, please contact me on my website, midlifeherbalwisdom.com. Thank you for listening.